We do have two audio options for you. One is joining via the phone, or the other one is computer audio. The only thing we ask with the phone audio is that if you do join on this option, please enter both the meeting ID and the participant ID to ensure that your phone and your account are linked together. Sorry, I went backwards on there. We do ask that you stay on mute while our speakers are presenting to avoid any background noise. But if you do have anything to say, comments, questions, or want to share a file or resource to anyone, you can do so in the chat box. Finally, we do ask that you update your name to include your organization, and you can do so via the instructions on the screen right now, but I will talk you through it. First would be to click on the participant icon located at the bottom of your toolbar, hover over your name, click More, Rename, and then type in your name, and to save it, click OK. And now I'm going to pass it back over to Jen.
Great, thanks so much, Kat. So this morning we have a couple of facilitators with us. We have Sandy Fuller, who is the OPQC Senior Director of Improvement Science. Myself, I'm Jennifer Terry. I'm the project manager for OPQC. And you just met Kat, who is the project specialist with our team at OPQC. And our presenters today, we are so grateful to have Alicia Brown. She is the Women's Health Quality Improvement Manager at the Ohio Department of Medicaid and the project lead for the Preterm Birth Improvement Project and the web-based pregnancy notification system, also known as Nurture Ohio and PRAF 2.0. And we also have with us today Dr. Michael Marcotte, who is the OPQC OB faculty lead. He's been with OPQC for many, many years, is our go-to expert, and he is a physician at TriHealth and Good Samaritan. Next slide. So our agenda today will start with some updates and overview from Dr. Marcotte on guidance from ACOG on the administration of progesterone. And then the majority of our time today will be spent with Alicia. She will be reviewing some updates that Medicaid has made to the PRAF and also giving a short demo of the PRAF 2.0 form submission. And then we'll save about 15 minutes at the end for some discussion and questions. So please feel free at any point during the presentation to add a question into the chat, and we'll make sure we have time at the end to get to those. So with that, I think I will pass it over to Dr. Marcotte.
Good morning. We thought we would start this morning with a poll just to find out if you are a provider or your practice provides prenatal care. We're interested to know what's happened since the prolonged study came out and find out what you're doing with progesterone. So if you could, we're just asking you to answer this simple question by choosing one of the choices. And again, if you're not practicing, it's no big deal. But if you are, or your practice is providing prenatal care, what's happened since the prolonged study came out over the last couple of years to your use of progesterone? And we'll just take a couple of minutes to see where we're at with that, and then we'll go from there.
Looks like we're still getting a few more responses, so maybe leave the poll open for a few more seconds and then.
Okay.
Kat, I think you can close it.
So it looks like either there's been a decrease or no change, and there is a fair number of people who may not be directly involved in prenatal care and don't really know. One responder said they have increased the progesterone use since the prolonged study. So in our last webinar, we had a few more providers, and we found that most people said they had not changed their practice of use of progesterone. And the bottom line really is that ACOG and really the International Society has recommended that we continue to offer progesterone. So I'll go through that history just briefly so that you all can be up to date on that. Next slide. So the original study in modern time was published in 2003, and it was a large multi-center study in the United States where we used 17-hydroxyprogesterone to try to prevent a recurrent preterm birth in patients who had a prior spontaneous preterm birth. And I think the demographics of the study is critical to understanding why ACOG and SMFM have recommended that we continue to use progesterone in patients despite the findings of a prolonged study. So first of all, obviously the population is the very highest risk patient population with markers of increased social determinants. And what they showed was that there was a significant reduction in spontaneous recurrent preterm birth in the population that received the 17-hydroxyprogesterone. And they actually stopped the study prior to completion because of the large effect size. In 2003, additionally, there was a study in Brazil that looked at the use of vaginal progesterones in women at high risk of preterm birth. And in that population, there was a significant number of patients with a short cervix. And that again showed significant reductions in preterm birth, both before early term and in the late preterm. So in 2008, ACOG and SMFM came out with a statement saying that progesterone supplementation should be offered to women with singleton pregnancies and a spontaneous preterm birth. Next slide. So in 2011, the FDA gave provisional approval of conditional approval of the 17-hydroxyprogesterone, and that began really since 2003 began the use of progesterone, and that led us to one of our major projects that we've had in OPQC with Medicaid around trying to increase the number of patients who are candidates for 17-hydroxyprogesterone. We also showed on a population level a significant reduction in recurrent preterm birth, particularly in patients at high risk of having that recurrence, which were in our African American population. In 2009, the study to confirm the findings of the MEIS study was started, and it actually went on for 9 years. It was an international study, and different from the MEIS study, it only included 7% of Black women. Only 23% of the women were in the United States, less than 10% smoked, and 90% were married. So less likely to reflect that high-risk population. And only 1.4% of women had a short cervix that were enrolled in the study. Those findings really make it hard to compare to the MEIS study, which was very different. And in this study, as contrasted by the MEIS study and the Fonseca study, there was no reduction in preterm birth. But it was underpowered because there was such a low incidence of the outcome of spontaneous preterm birth in the study. So it was hard to know how should we interpret this. Next slide. So in March of 2021, this year, Lancet published a large meta-analysis that looked at 31 trials to try to determine if there was any benefit of progesterone in patients at high risk for preterm birth. And what they showed was that progesterone reduced the rate of preterm birth, defined by less than 34 weeks of gestation. Vaginal progesterone had a significant effect, reducing the rate of spontaneous recurrent preterm birth by nearly 25%. And 17-hydroxyprogesterone, although less trials, almost equal number of patients, also showed a reduction. The confidence intervals did cross 1, so it makes it less certain if there truly is an effect. But the absolute risk of reduction was greatest in women with the short cervix. Next slide. So in conclusion, both SMFM and ACOG have said that patients with a singleton pregnancy and prior spontaneous preterm birth should be offered progesterone supplementation in the context of shared decision-making. And with the patient incorporating the available evidence and the patient preferences. And really the bottom line is the patients at highest risk are the patients that will benefit the most. And so at this time, it is still recommended that progesterone be offered, either injectable or vaginal progesterone. So I'm happy to answer questions at the end of our presentation, but I'll turn it over to Alicia, who we really have appreciated partnering with as we've developed these updated pregnancy risk assessment forms to really help you all connect with Medicaid and managed care so that you can optimize the resources for our patients at highest risk for pregnancy complications, including preterm birth. So I'll turn it over to Alicia. Thank you so much, Alicia, for joining us on a Monday morning.
Thank you, Dr. Marcotte, OPQC, and everyone for joining us on the call. I really appreciate your partnership and continuous practice with us to make sure that we can keep Ohio women safe and have improved birth outcomes. So thank you so much. Again, my name is Alicia Brown. I work for the Ohio Department of Medicaid in the Office of Health Innovation and Quality, and work in the quality improvement section. So today I'm going to be going over PRAF updates, as well as providing a brief overview of how to gain access to Nurture Ohio, add a practice to Nurture Ohio, and if we have time, I will also show how to submit a PRAF form. Next slide, please. So the key update is that Ohio Medicaid now has 2 sources for notification of pregnancy. So effective July 1st, we will have what's called a report of pregnancy, which we consider our early identifier of pregnancy from our practices that are non-obstetrical service providers. And then we also have a pregnancy risk assessment form, which is our pregnancy notification for our first prenatal visit, so for our obstetrical providers. Both forms can be submitted either via fax or via electronic submission through Nurture Ohio PRAF 2.0, which is Ohio's preferred method for pregnancy notifications. Next slide. So this change came about through our partnerships with OPQC, key conversations in the community, as well as with our clinical advisory committee and partners in the community. And so we wanted to make sure that we incentivize our providers for completing the electronic PRAF over our paper PRAF, because we believe that that is what is best for our patients, because it's connected to our electronic Medicaid system, our eligibility system, and provides an electronic resource for care coordination. And it's also, from what Dr. Marcotte mentioned, is what we have identified as maintaining coverage for our women as most effective. So what's happening July 1st is that we're increasing the reimbursement rate from $12.10 for the an electronic pregnancy risk assessment form to $90. And then we're also introducing the report of pregnancy, and we are reimbursing that at a rate of $30. And again, that goes into effect July 1st. And so what we're hoping to occur with the reimbursement rates and the introduction of the new form is that we can increase the number of clinical providers that are submitting our electronic pregnancy risk assessment, so we can maintain eligibility for our moms. And then we can also have increased referrals to Ohio Department of Health for WIC eligibility or enrollment in home visiting, evidence-based home visiting, but also make sure, as I mentioned earlier, that we have continuous eligibility for our moms. And so with, and I'll go into this a little further, with the connectivity that we have with our electronic PRAF, it's a direct connection to Ohio Medicaid's eligibility system. So once a PRAF is submitted, we can directly update an individual's pregnancy status, which is directly correlated to their eligibility. Next slide. So with this update, we have a codes and additional HCPCS codes that I wanted to go over to make it easy for reimbursement and claim submission. So the electronic PRAF is still the H1000 code. However, you want to also include the TH modifier when you're submitting your claim for the $90 reimbursement of the electronic PRAF. And again, we still have the $12.10 reimbursement for the paper PRAF. For the electronic report of pregnancy, that new code is T1023. And again, that's a $30 reimbursement. So please keep this as a resource and contact our provider hotline or for questions, the 800 number, and I can provide that to you later if you have continued billing questions. Next slide. So what is a report of pregnancy? So again, the report of pregnancy is what we would like to see submitted first for our moms. So it's when they go into an emergency room department, their primary care physician, a local health department or community clinic. It's what we expect to see from our non-obstetrical service providers that identify our moms as pregnant initially. So if an individual goes into an OBGYN practice and finds out they're pregnant, they would not submit a report of pregnancy, they would submit a PRAF. So this is specifically for our non-obstetric service providers, as well as our lead infant mortality community-based organizations and our OEI communities. It also is our way of connecting women to obstetrical service providers if they request services for that. So it's for us to connect those moms who may otherwise not be connected to an OBGYN to continue prenatal services. So again, this goes effect July 1st. It will be offered web-based, and it also will be a new form, which is the ODM 10257. And it is for all Medicaid recipients. So again, it is for primary care physicians, EDs, local health departments, community clinics, and community-based organizations to submit the PRAF. So we want to make sure that that we get this submitted regardless of any gestational age. If they're identified as being pregnant first, that we get that submitted. Next slide. And I briefly went over this, but again, this should be submitted by our non-obstetrical providers. And I think I went over this already, but the big piece is that it's one submission per pregnancy. So if a local health department has identified this individual as pregnant already prior to them going to their primary care physician, it's only for one submission. So it would be the local health department that would receive the reimbursement. Next slide. And again, our pregnancy risk assessment form is for the first prenatal visit. So our goal is to hopefully get the submission for the prenatal risk assessment form as early as possible as well. So it's for an obstetrical provider to submit this form. Our PRAF, similar to our report of pregnancy, is also connected to our eligibility system. So it will automatically update that individual's pregnancy via our Nurture Ohio system. But our PRAF is also, we like to say it's our communication hub for our pregnant moms. So it provides connectivity to their managed care organization if they have additional risk factors, whether it's medical or social. And it provides additional care coordination from our managed care plans in that respect. It also serves as an automatic referral to Ohio Department of Health, our sister agency, for evidence-based home visiting, as well as our WIC program. We've noticed that there are a large amount of moms who could be eligible for WIC who don't receive the services. So this is our way of making sure that our moms are being contacted or outreached for additional resources if they are eligible for them. And again, our PRAF is for all pregnant moms on Medicaid. And we again call this our preferred method because we want to make sure that our Medicaid moms maintain Medicaid eligibility and receive the resources that they need. And at this time, this is the most effective way that we have identified of doing so. Next slide. And again, this is for providers of obstetrical services. So our OBGYNs, MFMs, when you're identifying these moms at their first prenatal visit and providing them services, this would be the form that you would submit. And the PRAF is the one that receives the $90 reimbursement. And so there is one submission for the reimbursement. So it would be that first prenatal visit. We do still encourage our providers to submit an updated PRAF, and it's not the full PRAF. We've had some changes to our system that will allow you to go in and search for your prior submission and simply update the areas that have changed. So if an individual's medical or social risk factors have changed, we still do encourage the providers to go and update that and submit it so that our managed care plans are aware of the change in their history and can provide additional resources to that individual. Next slide. I think the big thing about the pregnancy risk assessment form is that we can streamline our communication. So it offers connectivity through our managed care plans. We can identify those risk factors for the individual, whether it be substance use and abuse disorder, if they are eligible for progesterone, or whether they have additional needs, transportation. If there are other areas that this individual needs assistance with, there is a field for you to type those areas in so that the managed care plan is aware of those need for additional resources and can provide that service to the individual. So it's a really good opportunity for us to become aware of the individual who is pregnant so that we can maintain eligibility during their prenatal and postpartum period, as well as making sure that we can provide care coordination for the individual. So next slide, please. So this is just, I wanted to provide a brief overview before going into the demo of what the PRAF look like if you are a new user to a pregnancy risk assessment form. So it's a shortened form of the original biologic form that Medicaid offered years ago, and it is a more condensed form of the ODM 3535 form. So it offers demographic information. We want to capture the identifiers that we need for connectivity in our eligibility system, which is the Medicaid ID for the individual and or the full Social Security number. We also need to know their first name, last name, their date of birth, and the estimated delivery due date. So those are the key factors that we need to make sure are absolutely accurate. And we also have a check within our Nurture Ohio system to confirm the information. But we really need that to connect to our eligibility system and update the Medicaid pregnancy, because that's the key purpose of the form, is to make sure we maintain the eligibility. And then we also have the risk factors that we can identify based on the patient's medical and social history. And we've worked really closely with OPQC to update our substance use and disorder needs section, which you will see in effect on July 1st on both our paper PRAF and electronic PRAF. But we have added these questions or these risk indicators back onto the PRAF after working with our internal policy and legal team, so that we can make sure we can provide the safe healthcare coordination and operation for our patients that may be in need for additional resources. So definitely look for the updated SUD questions. Other updates that you will see is we added the race and ethnicity identifiers based on how the individual self-identifies. So you'll see that updated on the electronic PRAF form. And then we also added, based on data from the current PRAF, the key language or the top 5 languages that were selected in the Nurture Ohio system for easy access. So look for these changes coming in July. Next form. And then I wanted to provide, I know I've talked about it at a high level, but I wanted to provide a visual of what our Nurture Ohio system does. So we're taking the information that you as providers enter into our Nurture Ohio system, and we're basically sending it and sharing it with the appropriate entities so that we can maintain eligibility for our moms by connecting it to Ohio Benefits, which is our eligibility system. And we also make sure that there's an automated alert that goes to our counties and an automated process for updating that eligibility system. And then the Nurture Ohio system is also taking the information that you provide and sharing it with the appropriate partners based on the risk identifier selected. So if on the PRAF form or even the risk report of pregnancy form, you indicate that this individual would like additional assistance from our managed care plan, we're connecting that information to the managed care plan so that they can provide additional care coordination for that individual, as well as know about that individual's pregnancy, even if there aren't additional risk factors, so that they can provide them additional services. If the individual is identified as being a progesterone candidate, the PRAF form also serves as a prescription that the provider can print out and use for administration of progesterone. And it also connects to home health agencies for individuals who would choose to have progesterone administered in the home. And again, it refers to our home visiting and WIC referral program. So it's really a full communication hub for our pregnant moms on Medicaid. And as Dr. Marcotte mentioned, through our continued efforts with the preterm birth effort, we have definitely identified that this is a key factor in ensuring that our moms have the best services that they need and maintaining eligibility for pregnancy so that they can get the services that they need. Next slide. Okay, so how do we gain access to Nurture Ohio? Next slide. So there are 3 key steps that we need to have each individual take when they're getting access. So the main, the first step is making sure that whoever is going to be submitting forms in Nurture Ohio, whether it's a front office staff, a clinical nurse, or someone in the practice, is typically not the OBGYN provider, but making sure that that individual has MITS access. So that is the first step, and that is also in our sorry about that. That's also in our provider manual. So definitely look at the provider manual and make sure that anyone that is going to be submitting PRAFs has the MITS user access. The second and the most important, if you are submitting a pregnancy risk assessment form, is to make sure that you contact your MITS administrator and you provide them with the username that you have established in MITS and request that they provide you a prenatal visit agent role in the MITS system. This is the key that unlocks the PRAF for our OBGYN providers. If you are not an OBGYN provider, you can skip this step. You simply just need to be a MITS user associated with a provider. And then the next step is that you would use your MITS credentials, or excuse me, the third step, you would use your MITS credentials to access the Nurture Ohio system. And I will show that to you on a future slide. Next slide. So we have a quick access guide, which is located in the user manual in the appendix. And it is also located on our Nurture Ohio website. And it goes through essentially in more detail what I have provided here. So the big piece is just making sure that any user has the MITS access, and that they also, if you're a prenatal risk assessment form user for an OBGYN practice, that you obtain that prenatal visit agent role. If you log into Nurture Ohio as an OBGYN provider and you see a report of pregnancy form, that is a key indicator that you do not have a prenatal visit form assigned to you, prenatal visit agent role assigned to you in MITS. If you log into Nurture Ohio and it indicates that you are not associated with a provider, that means that when you gave yourself access to MITS, that your MITS administrator did not assign you to a clinical practice. So those are key indicators that you want to contact either the progesterone email box, your MITS administrator, or the help box in Nurture Ohio, which I will show you for additional guidance. Next slide. So this is a landing page to Nurture Ohio where you will put your MITS credentials in. So the same username and password that you would enter into MITS, you would enter into Nurture Ohio. They are connected for that authentication purpose. Next slide. Okay, so let me pull up, give me a second, and I will pull up the Nurture Ohio staging site and provide you with a quick demo of what to do once you get access to Nurture Ohio and you get the prenatal visit agent role assigned if you are an OBGYN, or if you are not an OBGYN, once you get your MITS credentials and you provide and you become a report of pregnancy user. So let me get that pulled up here. Give me 1 second. Okay, can you see my screen?
Yes, we can.
Hi, Alicia, I can see your screen.
Okay, perfect. So once you log into Nurture Ohio, you'll go to a landing page. And essentially what we want you to do is we want each user to establish as a practice. Okay, so you'll click this internal practice test section. At the top, it will have your actual name on it. So mine would say Alicia Brown, and I would just click on it. It's going to take you to this page. It will have your information based on what you have in MITS. Okay, so your practice type as listed in MITS, your email, your first name, last name. It will also have a request for you to update your contact information. And this is important. If we have anything that we need to provide to you as a user, updates, anything, we will contact this information. It will also give you the option, say you are a new user, but your practice has already submitted PRAFs or ROPs in the past. You can simply search and see if your practice is in the system. If it is, you would simply select that and request access to the system. This is also true after you establish a new practice. You still need to request access to the practice. If your practice is not located in the system, you would simply go here to new practice request. You would enter in your practice name, street address, phone number, all of the contact information, whether you're an OPQC site, if you're a federally qualified health center. And this is really important. We need the provider billing number. And this is the practice level NPI number that we're requesting here. So you would enter that in and hit submit. I can't see the top here. Sorry about that. Okay, so you would hit submit, and then you can go back to the Nurture Ohio screen. Can you see my screen? I'm sorry. Hello?
We're still seeing a new practice request form.
Okay. Okay, so after you hit the submit screen, you would then go back, and as I did earlier, whatever new practice you entered, go back in and request access to that practice. And what that's going to do is it's going to send a notification to our internal vendor, our technical vendor, and myself, so that we can give you access to that system. Or to that practice. And what that's going to do is allow you to see all the patients associated with your individual practice. And it's also going to allow you to see any analytic functionality associated to that practice. And so as you can see here, I just submitted a request for Columbus OBGYN, New Albany, and you can see as you go into your system here, if your request has been granted, or if it's still awaiting approval. Okay. And then to submit a PRAF, so after you have obtained access to the Nurture Ohio system, you have also submitted a request for your new practice. You can go in and select your practice from a drop down. And so for this example, I'm just going to select a practice. All of your information that you entered will pre-populate based on the practice information. And this is important and something we heard back from our providers. They didn't want to enter, and it makes sense for a user experience not to have to enter the same information over and over again. And then you would select which provider you would like to, or prescriber assigned to this individual visit. So it's based on whoever submitted, whoever saw that patient, who's the rendering provider. You would select that information and hit the next button. And so it takes you to the screen. So this is our validation of information for our individual. So remember, there are the key indicators I mentioned earlier that we need to link this patient's PRAF details to our eligibility system. These are those key indicators. So we either need you to enter in the the patient's Medicaid ID, and their first name, last name, their date of birth. And there are some key, their social security number. What's not entering in? And their date of birth. And there are fail safes. It's letting me know I didn't enter in 12 digits. So this is doing a 30-day check is what's happening. It's looking over the past 30 days and checking to see if another practice entered a report of pregnancy or pregnancy risk assessment form. Remember, there's only one submission allowed. So it's going to do a check, and it's done the check, and it's letting me know that there are no records that were found in the past 30 days, so that I'm okay to submit my PRAF or ROP form. There is a validation that's done in this prior part. So I'm submitting for validation for the 30-day notice. There's another validation that's not going to show. That's not going to show on this demo, but it's going to check against our eligibility system. And for these areas, you'll get either green checks or red X's. And it's going to say, we found this individual in our Medicaid eligibility system, or the information you entered is not matching our system. Because sometimes we are human, we are going to fat finger information. So just be aware of that. If for some reason the information still is not matching in our eligibility system, it will give you a similar option to proceed without validation. Or you can go and proceed without validation and save for later if you want to go and check against another system to see if the information is accurate. And again, we want to, all of the information here will pre-populate from our check. So if this individual checked against our Medicaid system and our Medicaid system identified that they had CareSource as a Medicaid managed care plan, it's going to pre-populate this for you as well. So remember, I talked about entering in your provider billing NPI when you set up your practice. This is what comes over. It's automatically saved each time, but we also need to make sure we have the rendering provider's Medicaid ID. And there's a way for you to save that in the system as well. So you don't have to enter that in every time. And all of this information transferred over. You'll also put in your date of service. So we'll put it in today. It's confirming your practice information. And this information will transfer over. Oh, this is the managed care plan ID. You don't have to put this in, sorry. And this is really important. We really need the estimated date of confinement, or we cannot submit this form to our internal system for our eligibility. So just make sure you have this section filled out. And gestational weeks, days, number of fetuses. And so you'll simply, I know we're coming close on time and I want to make sure we have time for questions, but you'll essentially just go through and make sure that you answer all of the key fields within the form. Here's the new race question, race and ethnicity based on how the individual self-identifies. And here we go. We'll also enter the county. You can enter the patient's email address if you would like. And I wanted to get to the managed care plan question. So I would like my patient's managed care plan to communicate with me about any urgent needs. Here's a drop down of key indicators. These will change to align the earlier form that I showed with the opioid use questions. So I'm just going to select a few so you can see what happens within our system. So there are some follow-up questions, but the questions will match what's in the PRAF form. And there are follow-up questions to tobacco. So, and here's our progesterone question. So the individual is a progesterone candidate, and why. So this individual, we're going to have both prior preterm, prior spontaneous preterm birth and short cervix, and progesterone was offered. And then this is if the individual would like to use the specialty pharmacy for the prescription. So it's going to these are questions that are associated with the prescription. So you'll just go through and answer the questions. And I know we're running short on time, so I'm actually going to turn this over for any questions, but you continue to go through and you can either submit this form or you can save for later if there are questions that maybe you need to go back and check or make any changes to. You can save it for later and then resume when you come back. So thank you so much for your time today. I'm going to pause and turn this back over so we can have a question and answer section.
Thank you so much, Alicia, for all of your work in making the PRAF user-friendly and, most importantly, effective and getting resources to the moms that need them. I appreciate you joining us today to share the demo and to share all of the really wonderful updates and improvements that have been made to the form and to the system. We have been receiving a few questions in the chat. You all should feel free, attendees, to continue to put questions in the chat. If you are comfortable coming off of mute, we invite you to do that as well. The instructions for how to do so are at the bottom of this slide. But I'll go ahead and start, Alicia, with the first question that we received, which is, should they be filling out both forms for each new pregnancy? And I believe that's in reference to the ROP and the PRAF.
No, only one provider type should fill out one type of form. So OBGYNs will only submit PRAFs. Providers of non-obstetrical services will only submit reported pregnancies. And I do want to make a key note that the reported pregnancies are for any gestational age. So it's not until, even if the person hasn't determined what they want to, if they want to maintain that pregnancy or not, we want to make sure we learn about that pregnancy. So.
Great, thank you.
Mm-hmm.
So the next question we received is there a way to opt out of the PRAF serving as the progesterone prescription if our facility provides home health and supplies the progesterone?
Yes. So there was a question, I think I got to towards the end. You do not have to use that prescription. You can just continue. You can select that the individual is a progesterone candidate and that they are going to use progesterone administration. But those remaining questions, you do not have to fill out if you're going to be using your own prescription.
Great, thank you.
Hope that makes sense, but feel free to contact me through the progesterone pit box if you would like to.
Great. So the next question is, do you automatically get reimbursed when a PRAF is submitted, or does your practice have to bill for it?
Your practice does have to bill for both the PRAF and ROP. And if you have additional billing questions, please contact the provider helpline. But the key HCPCS codes that you would need associated with the service claim are in the presentation.
Great, thank you. This next question, I think I have the right context, but if I don't, please feel free to just add to it in the chat. So the question is, what is the modifier that needs submitted? And I think that's in reference to the setting up a site and adding a site in Nurture, Ohio.
The modifier, so that sounds like more like a billing question.
Okay.
So the modifier, I could be wrong. So the TH modifier, it will just be associated with the E&M service. So you would just put the H1000 and TH modifier with the E&M service. But again, I would contact billing for claims questions. If that's not the question and it is how to add additional practices, please put that in the chat as well and I can address that.
Okay, so the next question is, if I have an active MITS login, however, it is not for the PRAF, checks eligibility for billing, how do I get this changed to access the PRAF?
That's a great question. So you would email your MITS administrator, who is typically someone who handles the practice billing. And if you don't know who your MITS administrator is, typically the office practice manager does. Simply send them an email and provide them with your MITS username and inform them that you will be submitting PRAFs on behalf of your practice. And you need them to provide you access to the prenatal visit agent role in MITS. So this is an action that the MITS administrator can perform. There's also additional instruction in the provider user manual for the MITS administrator if they do not know how to assign you that role.
Great, thank you. The next question is a bit of a clarification on definition. Could you please explain what FQHS means, what that stands for?
FQHC is a federally qualified health center.
Great, thanks.
Mm-hmm.
Okay, for other needs, is it possible for sites to alert to housing needs?
There is an additional other needs section that is free form and will allow you to type that in. So yes, you can do that. At this time, it is not a key indicator on the PRAF. It's something we've talked about adding, but we like to make sure that we have additional resources to provide for the individual for any fields we add. So that's a good question. And I know it's something a lot of our moms are experiencing right now. But yes, you can add that onto the other needs free form section within the managed care plan. My patient could use assistance with the managed care plan. They will get that information and try to connect that individual to community resources as available.
And thank you, Lindsay, for putting your question back in. I missed one a little bit earlier. What if your practice has moved and the address needs to be updated?
That's a great question. So you can go back into, let me see if I still have this up. The form and select your name at the top. I'm going to try and share briefly. You can go back in and share. Okay. So it logged me out. Okay. So for the sake of time, you can go back in and hit your name at the top. And then all of your practice information will be there. You can edit that information by entering into that section where it has your practice information. If not, simply email the PIP email box and or the help button, and we can assist you in updating that information.
Thank you.
Mm-hmm.
The next question says, I do not have the opioid selection populated yet, or has that not started? So can you please share when that will be live?
So the opioid question on the electronic PRAF is live, has been live since March. So if you're not viewing it, please send me an email. But it is live. The updated questions on the paper PRAF will not be live until July, but it is in the Nurture Ohio system.
Thank you. Okay, so then the next question, I think you've answered this, but just to clarify, so there's a question about, will the PRAF serve as the prescription for progesterone?
Yes, so if an individual is identified as needing progesterone, there is an additional additional page that will print out and serve as the prescription. So yes, you do have to print it out and it will serve as the prescription.
Okay, So the next question says, I've been submitting PRAFs for a while now. Will I need to do anything differently? For reimbursement, do we need to submit a charge?
So if you're currently submitting PRAFs electronically, then I would just inform your office practice manager and your billing department of the change and that they need to submit the TH modifier. So it's still H1000 plus the TH modifier to receive the $90 increased reimbursement.
Great. The next question is, would you like us to still submit a PRAF even if the patient has none of the risks on the list?
Absolutely. Whoever asked that question, thank you. Absolutely. So again, it's the PRAF is to maintain eligibility as well. So if we do not know about that individual's pregnancy at their next redetermination, they could lose coverage. So even if they don't have any risk factors, if you identify that individual's pregnancy, yes, please submit the PRAF because we will add that pregnancy to their Medicaid status, and that will maintain that individual maintains coverage throughout their postpartum period. Great question.
Okay, and I think we have time for maybe one more, which is a question around whether the electronic PRAF automatically updates itself. And I think this is in reference to when changes are made, do they need to do anything to receive the changes?
No, you don't have to do anything. That's a great question as well. It will automatically update. So our updates usually occur like on a Friday night or Saturday night when individuals aren't typically using the PRAF system. So no, there's nothing you have to do. Just log in and keep using it.
Great. Thank you so much again, Alicia, for your time and for sharing these updates and answering everyone's questions. So just thank you to all the attendees for joining us this morning. I think we've shared in the chat, but we will send a copy of slides out to this group later this week, and a recording will be made available on our OPQC website. And you can send any questions, and Christine, I see you just asked this question in the chat as well. Any questions specifically about the PRAF or access can be sent to progesterone_PIP@medicaid.ohio.gov. And again, you can see that email address on the screen. And I see one question in the chat, when will the recording be available? Jennifer, it'll probably be available later this week. I would say no later than Friday. So Kat, if you wanna go to our last slide. All right, thanks again, everybody, for joining. We appreciate your time this morning. Enjoy the rest of your Monday. Thanks so much.